The Sultanate of Oman has accomplished explicit achievements in the area of health development due to the political commitment taken on the part of the government for the provision of health for all the population, and because of the extensive efforts made by the government, which received commendations by all international organizations and bodies. The international organization considered Oman one of the fastest countries in reducing child mortality rates during the 80s and 90s. The reduction of child mortality rates continues for the next 2 decades, as the infant mortality rate per 1,000 live births declined from 118 in 1972 to 16.7 in 2000, and then to 9.5 in 2017. Controlling the communicable diseases and hazardous diseases of childhood was the main reasons for the decrease in mortality rates. The strategies adopted by the ministry led to the absence of certain diseases such as polio, diphtheria, and neonatal tetanus in the Sultanate during the past 2 decades. There has been no cases of measles during the past 2 years. Moreover, the hepatitis cases dropped by 68% compared to 2005, and the malaria was controlled, knowing that there was 1 out of every 3 individuals in the community suffering from malaria in 1975, as 241,431 malaria cases were reported at the time. However, with control measures, the number of cases decreased and eradicated. The ministry's strategies adopted in controlling pediatric malnutrition have also succeeded in reducing underweight children under 5 years of age. In the field of maternal health care, the rate of early pregnancy care was about 73.3%. Only less than 1% of mothers giving birth were not registered for pregnancy care services. The average number of visits for pregnancy follow-up services was 5.8 compared to the recommended 6 visits. In 2016, the 9th 5-year plan for health development 2016-2020 was approved and was developed in the new methodology that consistent with the demographic and population change, as well as with the health and technical development witnessed by the world. The plan formed on the results-based planning method that was based on the Health System Vision Health 2050, which represent a quantum leap in the future health planning process, where the 5th 5-year plan directed its strategies and objectives through the 7 themes. The preparation of the Health Vision 2050 has led to the development of the Health Atlas, which includes the future projections of the population, the needs of health services and medical devices, equipping in addition to the use of these services and human resources for health at the national level, divided at the governorate level and presented on maps by GIC. The Sultanate achievements in the field of controlling communicable diseases in the reduction of mortality have been through its interest in the primary health care and its emphasis on being the main access point for all levels of health care.